Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance and Minimize Injuries. Thank you for viewing today's episode of Dr. Ozello's Sports Medicine Report. Please feel free to leave feedback, suggestions, or questions in the comments section. Please feel free to like this video. You could go to my website at championshipchiropractic.com where you can get additional information on the book, and you can also see how to connect with me on other forms of social media. Please enjoy this sports medicine video. Today's episode of Dr. Ozello's Sports Medicine Report is about the stress fracture. The stress fracture is a very common sports injury. The stress fracture can occur in any bone in the body. Obviously, in runners, most of the time it's going to occur in the lower extremity. In throwing athletes, in rowers, it's going to happen in the upper body. Stress fractures occur for two very specific reasons. One reason is that there is a normal amount of stress being placed on an abnormal bone or an unhealthy bone. That is called a pathological fracture. In sports medicine, sports injuries, most injuries occur with the second type, which is an overuse injury. That is when there is an abnormal demand or too great of a demand placed on healthy bone. So that's what I'm going to be talking about today, is why these stress fractures occur and what you can do to prevent them and what you can do to recover from a stress fracture. Stress fractures are classic textbook overuse injuries. They occur from a repetitive submaximal load. It's repetitive trauma combined with inadequate rest. The pain is a very deep-seated pain in a specific area, specific spot. Most people who have a stress fracture, they'll say, I have pain right there, or I have pain right here, or wherever the pain is at. They can point to a very specific area, but that pain is very deep-seated. It is very tender to the touch. Usually the pain comes on during activity, and it will go in the beginning stages. It's going to go away when we're not doing the activity that's causing the symptoms. But as it progresses, it could become almost constant. But in the early stages, the pain will not be there during inactivity. But as soon as the athlete starts performing the aggravating activity, that pain begins. And they're going to feel it throughout the entire activity. The pain begins in an insidious onset. There's not one incident that causes this pain. Okay? It's not a fracture where you get hit or you fall down and that bone breaks. This is an insidious onset that takes a while to develop, and those symptoms take a long time to really start to aggravate. So you want to make sure as soon as you feel something and you suspect that it's a stress fracture, you want to modify your training, and we're going to talk about this later on, and you want to get it checked. You want to make sure that you are treating this in the very beginning stages. Okay. Prevention is the most important, and then quick action when symptoms begin is the second most important. Other symptoms that may occur with the stress fracture is swelling. Swelling over that specific area of pain. In the beginning stages, usually it occurs with the activity and will go away with rest. But just like the other symptoms, just like that deep-seated pain, when this condition worsens, and it progressively worsens if the training is not modified, if that aggravating activity still continues, the condition will worsen. If the condition worsens, then that swelling will become more constant. It will not only be there during the activity and right after the activity, but will be there almost constantly. The human body is incredible. There's so many fascinating things that occur within our bodies. The musculoskeletal system is just fantastic. One of the things that is so amazing about our bodies is the skeletal system and the bone remodeling. It's fascinating. And what I mean by that is that the bones are constantly remodeling so that they become stronger along lines of mechanical stress. Meaning that wherever the greatest demand is placed, the bones will grow stronger in that area. Bone is always reabsorbed and then redistributed to the areas where the greatest demand is placed, where it's needed the most. So we think about runners. Yes, if they have adequate training with sufficient rest, the bones in the lower extremity will grow stronger. Same thing with weightlifters. It will continually make their bones stronger. Now, the problem is when inadequate rest comes into the picture, when there is too much training and not enough rest. Like I mentioned, how the bones are constantly remodeling. If there is not enough rest in between training sessions and or our competitions, the bone does not have enough time to grow stronger. So the bone tissue is not recovering from the training sessions, and it starts to weaken from the amount of training and the inadequate rest. That is where the stress fracture occurs from. In normal healthy bone, when there is a great balance, a normal balance, perfect balance, however you want to say it, between the amount of training, the amount of use, and the amount of rest, the bones are going to grow stronger where they're needed. But when there is too much training and inadequate rest, those bones are not going to grow stronger. The bone remodeling is not going to be able to take place and keep up with the overtraining. So that's where the stress fracture occurs at. As I mentioned earlier, prevention is the key when it comes to stress fractures. And then quick action is right behind prevention when you feel these symptoms coming on. What you want to do to prevent this injury is obviously have a good training routine. Make sure that you work in active and passive recovery days into your training. You want to give your body and your skeletal system time to recover from your workouts so your bones grow stronger. Not only are your muscles and your ligaments and your tendons going to grow stronger, and your heart and your lungs, but your bones need to grow stronger too. And if you give your body adequate rest between training sessions, that will happen. Other factors are strengthening the entire kinetic chain, meaning using cross training, using resistance training, and working the entire body, strengthening the muscles and the bones, especially in areas that are going to be used with the activity that you're going to be doing. Like I mentioned, throwing athletes. Okay, throwing athletes, often they will get a stress fracture in the upper ribs. Okay, so what they want to do is they want to strengthen the entire chain, not just the arm. They want to strengthen the muscles in the back of the shoulder blade. They want to strengthen everything in what is called the arm trunk mechanism, everything that controls the movement of the shoulder blades and the shoulder, the upper body, the core, the lower body. Everything works when we're throwing. The same thing when we're running. We want to make sure that the feet are strong. We want to make sure that the ankles are strong, the lower leg is strong, and there's balance in that strength, and there's flexibility in those muscles. We want to make sure that all the joints are healthy, including the ankle, the hips, the ankle, the knees. These are the knees and the hips. We want to make sure that all that is functioning as well as it can. Make sure that the pelvis is strengthening as well as it can. Make sure that we have eliminated every strength imbalance and that we have a strong core and the entire, what we call a kinetic chain, everything is working the way that it should. That will help to prevent stress fractures. Also, proper nutrition. Nutrition. I cannot stress this enough. You want to eat as well as you can in the preventative phase and in the rehab phase. This is so important, is to eat properly, give your body the resources that it needs to prevent injuries and to recover from injuries. If you suspect that you have a stress fracture, if the symptoms that you're feeling are what I described earlier, do not hesitate. Seek professional care immediately. Do not try to train through this injury. If you do, the condition will only progress and get worse, which will obviously make your rehabilitation time greater. Seek professional care. Most likely you will need imaging. An x-ray will most likely be taken. Now an x-ray, a stress fracture usually does not show up on x-ray till after about a month. So there may be other testing that's needed to be done. Maybe a CT scan, maybe a bone scan, or an MRI. The MRI is by far the most superior. The MRI is very sensitive and it's very specific for finding a stress fracture. So that will be your best bet in helping to get the correct diagnosis. A correct diagnosis of a stress fracture is extremely important because it allows you to start your professional treatment and your self-treatment as soon as possible. If you develop a stress fracture or you think you're developing a stress fracture, you want to take a break from the causative activity. Whatever type of exercise that it is, you want to take a break from that. If you do not, the condition will worsen. It's going to progress, it's going to get worse, and it's going to take longer to recover from. So you want to take a break from that activity. After about 5, 6, or 7 days, then you could start with a different type of activity that does not place stress on the area of fracture. If you are a runner and you start to develop a stress fracture, you're diagnosed with a stress fracture, do not run. I know that's tough for you to hear, especially if you love to run, all right? But it is something that you need to do for your long-term health and fitness and your long-standing running career. Take a break from that activity. Like I said, about 5 to 7 days, you want to take a complete break, and then after that, you can start with a non-weight bearing type of exercise. For example, you could get on the bike. If riding the bike does not stress the specific bone that where the stress fracture is located at, then you ride the bike because it's going to help to maintain your heart strength and your lung strength, your musculoskeletal strength. So you don't want to sit down and do nothing. For that first, like I said, 5 to 7 days, you need to do the passive recovery, but then after that, you can get on the bike or you can get in a pool and you could swim. Fantastic type of an exercise that's going to help you a great deal. If you can do yoga, if you can do Pilates, those type of exercises are going to be great for your mind because you're going to be doing something and they're going to be great for your body. I always tell people when you're recovering from a stress fracture, that's a great time to do some additional stretching. Any stretch that does not place tension on the area where the stress fracture is at, you can do that stretch. It's going to help you a great deal in the short term and in the long term. It's going to help to reduce muscle tension. Another thing you can do that helps reduce muscle tension is foam rolling. Foam rolling is fantastic for reducing muscle tension. Now, if you have a stress fracture, you have to be very careful. Common sense tells us, but people still do this, is you want to avoid the area where the stress fracture is at. Never, never, never foam roll over the bone that the stress fracture is located at, and never foam roll over a muscle that attaches to that bone. You want to be extra careful. If you give the body the proper amount of rest and feed it the way that it should be fed, give it the resources that it needs, a stress fracture should heal in about 6 to 8 weeks. Now, it seems like a long time, but if you do things correctly, you will be able to start your training at about 6 to 8 weeks from the time that the stress fracture occurred. What you want to do is begin back very gradually. If you have done your cross training during your recovery, your training level should not have decreased that much, okay? Maybe it didn't decrease at all. So when you start up, you just have to pay extremely good attention to how everything feels. Start very, very light. very short distance if you're a runner, and build up very, very gradually. If you start to feel pain in that bone again, then obviously you want to stop and you want to continue with your cross training, and you want to give your body more time to recover. Stress fracture is an extremely tough injury, but it's very preventable, and we can recover from a stress fracture. You just have to give your body adequate rest, give it the nutrition that it needs to recover. Several key factors in your training. Once you have returned to training, during the recovery phase and in the preventative phase, there's a couple things that you want to do. First of all, you want to strengthen your bones. Your bones can be strengthened through resistance training, especially weight-bearing resistance training. It's going to help a great deal. Also, you want to correct any biomechanical faults that you may have, because a biomechanical fault can contribute to a stress fracture. What I mean by that is when you step, if you hyperpronate, you want to make sure that you strengthen your feet muscles and you help to prevent the hyperpronation. That's just one example. But you want to correct all of the biomechanical faults that you have. It's going to help to prevent all types of injuries. It's going to help you to recover from all types of injuries. And it's also going to help to prevent a recurrence. Nutrition. I had mentioned nutrition before. Just sort of mentioned it, didn't really talk about the specifics. But what I want to talk about now is nutrition and supplementation. Because nutrition and supplementation are ideal tools to place our bodies in a position to help to prevent injuries and help to recover from injuries. If you do not provide your body with the adequate amount of fuel, you're setting yourself up for injury. If you have a nutritional deficiency, then you are setting yourself up for an injury. You want to put your body in a position where it functions at its highest capability and it is able to recover and prevent injuries. You do that by training, by giving yourself adequate rest, and with proper nutrition. Lean proteins are extremely important. Healthy fats, those are two very important things that are going to help to strengthen the musculoskeletal system. Vitamin D, vitamin A, calcium. Calcium is extremely important in vitamin K. When you are training, if you want to, you can get blood tests done, you can get hair tissue mineral analysis done. Those two are going to give you some very good information on different levels so that you can modify your nutrition, you can modify your supplementation to help to eliminate any issues that you may have before symptoms start to occur. For example, with the hair tissue mineral analysis that I mentioned, you will get the levels of your calcium, you will get the levels of many other minerals, and you're also going to get the ratio of calcium versus several other minerals. So that may help you in your supplementation strategies as to what you need to help to get the proper levels and the proper ratios of calcium, say like calcium to phosphorus. That may help you to prevent an injury. So it's extremely important. When we speak about calcium, there's a couple things that you need to know. First of all, vitamin D is extremely important for proper calcium. Okay, vitamin D helps to place the calcium into the bones. Vitamin K is extremely important for calcium. Vitamin K helps to move the calcium to where it needs to be, helps to put it in the proper place is the easiest way to say it. Also, the gut needs to be functioning, especially the stomach. The pH in the stomach needs to be functioning properly. It needs to be at the correct level so that the calcium can be absorbed. So if you have some gut issues, you want to look into fixing those. It's going to help you a great deal with your calcium absorption. You want to make sure that your gut is functioning as well as it can. Do everything that you possibly can to prevent a stress fracture. stress fracture sucks. Oh man, it's an injury that I don't ever want to see any of my patients have, because it takes us away from the activities that we love to do. But they do occur. So we want to do everything we can to prevent them, everything we can to recover from them, and everything we can to prevent a reoccurrence. So you want to train hard, you want to train smart. You want to give yourself adequate rest between training sessions. You want to remove all the causative factors, strengthen the entire kinetic chain, strengthen the entire skeleton, and feed your body properly with good nutrition and good supplementation. When I speak about supplementation, your best choices are supplements that are derived from certified organic whole foods. Utilize intelligent nutrition and supplementation strategies that work for you. Supplementation is best, like I stated before, when those supplements are derived from certified organic whole foods, because they are from foods. Foods are life-sustaining. When you have supplements that are derived from foods, not made in a laboratory, but derived from food, it is going to enhance your nutrition and is going to complement everything that you are doing nutritionally and in the gym to improve your health, to prevent injuries, and to help you to recover from injuries, because you are eliminating any nutritional deficiencies. In conclusion, stress fractures are a common sports injury. As an athlete, you want to do everything that you can to prevent this troublesome injury, to recover from this injury, and also to prevent a reoccurrence. Stress fractures are a chapter in my book, Running, Maximize Performance, and Minimize Injuries. Also, there's a chapter on nutrition for injury recovery, and there is a chapter about rest and recovery. This is Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I want to thank you for viewing today's edition of Dr. Ozello's Sports Medicine Report. Please feel free to like this video. If you have questions, feedback, or suggestions, please leave them in the comment section. Train hard, train smart, stay injury-free, and accomplish your goals.